So now we're at my probably, and I know I say this all the time, but really this is one of my favorite parts, is where we get the opportunity to recognize folks who do great things in our community. So first up is obviously, and she's not here today because unfortunately I know there's some things that pulled Patty away, but Patty is currently my board chair. She'll be done at the end of this year, but really do value her leadership. It's a lot of work, a lot of time, and no better person this year with a lot of things that we've gone through. So thank you, Patty, for your leadership as our board chair. So for our first award, in our 2024 Community Leadership Award, want to recognize Mike Phillips. Mike is the Senior Director of Patient Advocacy and Housing for Jewish Family Services of San Diego. So what I would say is, remember when I started the morning off today, I said, remember our why, like why did you get into healthcare? And it always revolves around wanting to help others. Mike is one of those who epitomizes helping others, will go above and beyond. I mean, when I think about the work Mike does, he's a patient advocate, but he's also a collaborator. So, a lot of times advocacy, collaboration don't necessarily always go hand in hand, but Mike comes to the table looking for solutions. And, even recently, and I don't even know what we'd call this group, Mike, but we have this SB 43 work group at the county level. Mike was in the hospital, mind you, and was trying to find a way to still participate as a chair for that group. Fortunately, one of the docs in the group said, Mike, we got it this time. But that just shows you his dedication. And I will share, I think he shared this last year, but Mike shared a story about a time where, there was a violent patient in a facility. He went in to try and help because the facility was frustrated, didn't know what to do, how to discharge this patient or where to turn. And he brought together this older gentleman and the facility and actually asked the patient, what's going well? What do you need? What's causing a lot of the violence and aggression? And the person responded that the soap here is terrible. And, for those case managers, I'm sure you've heard these stories all the time, but Mike went as far to go buy some Irish Spring soap. And last year, and I take it as a compliment, I don't think he was telling me I need to go shower, but he gave me a bar of soap. Or maybe he was telling me, Mike, you can address that when you get up here. But, it just shows, somebody who truly cares about the patient, puts the patient in the center. And really, we need more Mike Phillips in this community because, frankly, you don't go wrong when you do that. And frankly, if you want more Mike Phillips, you can go to the Jewish Family Services website and you can see his SB 43 videos because he's done a lot of training there. So without further ado, Mike, if you'd come up, please. So this award is presented to Mike Phillips with appreciation for your leadership, advocacy, and collaboration to address issues critical to meeting the behavioral health needs in our region. Here, I'll put it in. Thank you. Before one of us breaks it.
Thank you, everybody. It's making me cry. I want to say I'm so proud to be up here today, especially when I realized that the people that have been up here recently were people like Dr. Wilma Wooten, Greg Knoll, who is was a friend and a personal mentor of mine. And so I am incredibly proud to be up here, but my imposter syndrome keeps telling me, Mike, if you're up here, they must be running out of people to give this award to. So I know that's not the case about the next person that's going to get the award, but maybe for me. I want to speak to what Dimitrios said. I am incredibly proud to be part of such a collaborative environment. I do a lot of work across the state, and they are not collaborative in a lot of the other places in the state. People don't know who to call, or if they know who to call, someone's not going to answer that phone. So when we have a problem here in San Diego and in Imperial counties, we roll up our sleeves and we come together, and everybody's at the table. Law enforcement, hospitals, NAMI, peers, legal aid, everybody comes together, the court. And so we don't shy away from problems. We know when there's problems that are going to be big. SB 43 is one that we're dealing with right now. But when that happens, we roll up our sleeves and we come together and we have that collaboration and we make those tough decisions. And there's really not egos at the table. People are not doing their corporate stance and their professional. Sorry, we can't help. It's how can we help? I want to thank, to the extent that I look good up here, I want to thank my team, some of whom are here today, because to the extent that I look good is because they make me look good. Lee Lawrence, I've been working with Lee Lawrence for 30, almost, he's been doing this for 30 years and I've been working with him for 20. And I wasn't gonna say it, and I'll be quick, but since Dimitrios brought it up, when I got the email about this award, I literally was in a hospital bed, hospitalized. I wasn't working in a hospital, I was hospitalized. I was going septic, really bad headspace. And I got this email and I said, you know what? It's not over. I still got more work to do. I need to get up. I need to get back to work. And here I am. So lastly, so you don't think I'm going to rest on my laurels, at 12:30, I'm going to step into the lobby and I'm going to present to Scripps Chula Vista on SB 43. I told Jerry Gold, I'm getting an award. He said, I don't care, Mike. We need you to do this presentation. So and if any of you needs a presentation on SB 43 or really on anything else at all, I want to be super collaborative. My team is. Anything we can do to help about anything at all, please come find me. And thank you all for giving me this award. Thank you.
If that's not dedication, I'm sorry. I'm in a hospital bed. I'm not thinking about work at that point. Next up, we also want to give an award, our 2024 Community Health Leadership Award, to the Imperial Valley Health District. That award will be received by Katie Burnworth, who is the president of the Imperial Valley Health District Board of Directors. So Imperial Valley, when we had this conversation, it was like obvious, just talking to folks, you know, what's happening out in Imperial, who is doing some great work. And by and large, all we kept hearing is about the Imperial Valley Health District. As a reminder, during COVID, the two hospitals out there and Imperial County was like the epicenter in the country for breakouts and all sorts of things happening. So you go from that to a time when you had two financially struggling hospitals. And obviously legislation forces things at time, but really look to bring the two facilities together, bring the districts together. And it's those folks leading the Imperial Valley Health District who have done the hard work, rolled up their sleeves, figuring out how can we do better for the community? How can we ensure healthcare survives out in Imperial County? And what can we do to collaborate? And really, that's why we want to recognize them, because though the work isn't easy, it is important. And healthcare, you know, frankly, 2 hours from here matters just as much as it does in San Diego County. So, Katie, if you'd come up, please. I was looking that way because I knew they were over there. So, this award is with appreciation for your exceptional leadership and steadfast dedication to addressing the health needs of the Imperial Valley community.
I'm so honored to be here today. I know, as a previous speaker mentioned, imposter syndrome. I always think that to myself anytime somebody's going, you're doing all these great things, because when you're in the moment, you never really think about what you're doing. You're just kind of doing it. So it's such an honor to receive the Community Champion Award for the Imperial Valley Healthcare District. Because let me tell you, this past year, since we've been working on unifying these two healthcare districts, has seemed like anything but a victory lap. It's been more like a Ninja Warrior obstacle course that I didn't particularly train for. So when Assembly Bill 918 was signed, it wasn't this magic wand that was going to save the healthcare system in the Imperial Valley. But it was a roadmap that laid out how to unify the healthcare in the Imperial Valley. And it didn't come with any shortcuts. It had hard milestones we had to meet with deadlines, an abundance of scrutiny, and plenty of people telling us it couldn't be done. But what I found the most ironic about it was, for the first time I think I've ever heard, was that the government was moving too fast. But here's the thing. My board, we're doing it. This year, we've checked off milestone after milestone, turning legislation into action and vision into progress. From building our team from the ground up, because at our first meeting, we had a whole one staff member, to building partnerships and collaborating and reaching out to anybody who we could pick their brain on to learn about what is going on and how we're going to make this happen. But every step has brought us closer to creating a sustainable, locally driven healthcare system. But let's not forget, absolutely nothing about this is easy, as we're clearly finding out. Yet our board, our partners, and our community has refused to accept that this is impossible. Through persistence and innovation and collaboration, we've faced our challenges head on to achieve real change, because the status quo of our healthcare system in the Imperial Valley is not acceptable, and our residents deserve better. Today's award isn't just about celebrating what's accomplished. It's a reminder that we're just getting started. The foundation is in place, and now it's up to all of us in our community to keep building a united, stronger, and healthier Imperial Valley. Thank you all of you here today for this honor and for believing in what we're creating together. Thank you.